Mechanism of action for AFINITOR everolimus tablets and AFINITOR disperse everolimus tablets for oral suspension. Tuberous sclerosis complex, or TSC, is a rare genetic disorder that causes manifestations in multiple organs, including the brain and kidneys. Let's take a closer look at the underlying cause of the disease. Two genes play a key role in the development of TSC. The TSC1 and TSC2 genes code for hamartin and tuberin, respectively, two proteins that form a complex called TSC1, TSC2. In normal cells, the function of the TSC1-TSC2 complex is to inhibit mammalian target of rapamycin, or mTOR, helping control the process of cell growth and proliferation. In up to 85% of patients with TSC, the TSC1-TSC2 genes are lost or deactivated, leading to hyperactivation of mTOR. The result is dysregulated cell growth and uncontrolled cell proliferation. This mTOR hyperactivation leads to a variety of manifestations of TSC, including the formation of benign hamartomas. These include life-threatening kidney tumors called renal angiomyolipomas and brain tumors called subependymal giant cell astrocytomas, or SAGAs. In addition, mTOR hyperactivation drives the neurologic manifestations of TSC-associated partial onset seizures. Dysregulated mTOR signaling impacts both structural and functional processes, which are critical to normal brain development, which can lead to severe and frequent TSC-associated seizures. AFINITOR and AFINITOR disperse are mTOR inhibitors, meaning they mediate the hyperactive mTOR signaling to block the effects caused by the loss of the TSC1-TSC2 genes and reduce cell growth, proliferation, and angiogenesis as observed in vitro and/or in vivo studies. Preclinical animal models have also shown the potential of mTOR inhibition by increasing neuron myelination and synaptic plasticity. By inhibiting mTOR, AFINITOR and AFINITOR disperse block the effects caused by the loss of the TSC1-TSC2 genes and reduce cell growth, proliferation, and angiogenesis. AFINITOR is the only FDA-approved mTOR inhibitor indicated for the treatment of adult patients with renal angiomyolipoma and TSC not requiring immediate surgery. AFINITOR disperse is the only FDA-approved mTOR inhibitor indicated for the adjunctive treatment of adult and pediatric patients aged 2 years and older with TSC-associated partial onset seizures. AFINITOR and AFINITOR disperse are the only FDA-approved mTOR inhibitors indicated in adult and pediatric patients 1 year and older with TSC for the treatment of SAGA that requires therapeutic intervention but cannot be curatively resected.
Important safety information. AFINITOR everolimus tablets and AFINITOR disperse everolimus tablets for oral suspension are contraindicated in patients with clinically significant hypersensitivity to everolimus or to other rapamycin derivatives. There have been reports of non-infectious pneumonitis, including some with pulmonary hypertension as a secondary event, and infections in patients taking AFINITOR or AFINITOR disperse. Withhold or permanently discontinue based on severity. Hypersensitivity reactions have been observed in patients taking AFINITOR or AFINITOR disperse and include anaphylaxis, dyspnea, flushing, chest pain, and angioedema, for example, swelling of the airways or tongue, with or without respiratory impairment. Permanently discontinue AFINITOR or AFINITOR disperse for the development of clinically significant hypersensitivity. Patients taking concomitant angiotensin-converting enzyme ACE inhibitor may be at increased risk for angioedema. Permanently discontinue AFINITOR or AFINITOR disperse for angioedema. Stomatitis, including mouth ulcers and oral mucositis, is the most frequently occurring adverse event and occurred in 44% to 78% of patients taking AFINITOR or AFINITOR disperse across the clinical trial experience. Stomatitis most often occurs within the first 8 weeks of treatment. When starting AFINITOR or AFINITOR Disperse, initiating dexamethasone alcohol-free oral solution as a swish and spit mouthwash reduces the incidence and severity of stomatitis. This has not been studied in pediatric patients. Cases of renal failure, including acute renal failure, some with a fatal outcome, have occurred in patients taking AFINITOR or AFINITOR Disperse. Monitor renal function prior to starting AFINITOR or AFINITOR Disperse and annually thereafter. Monitor renal function at least every 6 months in patients who have additional risk factors for renal failure. Impaired wound healing can occur in patients who receive drugs that inhibit the vascular endothelial growth factor (VEGF) signaling pathway. Withhold AFINITOR or AFINITOR Disperse for at least 1 week prior to elective surgery. Do not administer for at least 2 weeks following major surgery and until adequate wound healing occurs. The safety of resuming treatment upon resolution of wound healing complications has not been established. Hyperglycemia, hypercholesterolemia, and hypertriglyceridemia have been reported in patients taking AFINITOR and AFINITOR Disperse. In non-diabetic patients, monitor fasting serum glucose prior to starting AFINITOR or AFINITOR Disperse and annually thereafter. In diabetic patients, monitor fasting serum glucose more frequently, as clinically indicated. Monitor lipid profile prior to starting AFINITOR or AFINITOR Disperse and annually thereafter. When possible, achieve optimal glucose and lipid control prior to starting AFINITOR or AFINITOR Disperse. For grade 3 to 4 metabolic events, withhold or permanently discontinue AFINITOR or AFINITOR Disperse based on severity. Anemia, lymphopenia, neutropenia, and thrombocytopenia have been reported in patients taking AFINITOR or AFINITOR Disperse. Monitor complete blood count prior to starting AFINITOR or AFINITOR Disperse every 6 months for the first year of treatment and annually thereafter. Withhold or permanently discontinue AFINITOR or AFINITOR Disperse based on severity. The use of live vaccines and close contact with those who have received live vaccines should be avoided. AFINITOR and AFINITOR Disperse can cause fetal harm when administered to a pregnant woman. Advise patients of reproductive potential to avoid becoming pregnant and to use effective contraception. Radiation sensitization and recall, in some cases severe, involving cutaneous and visceral organs, including radiation esophagitis and pneumonitis, have been reported in patients treated with radiation before, during, or after AFINITOR Disperse treatment. Monitor patients closely when administering AFINITOR Disperse during or sequentially with radiation treatment. The most common adverse reactions, incidence greater than or equal to 30%, were stomatitis and respiratory tract infections. Please see full prescribing information for AFINITOR and AFINITOR Disperse at www.afinitor.com.